social anxiety disorder?
The old name was social phobia, just in case you may have heard of that phrase, but now the official diagnosis name is social anxiety disorder, which is a mental health condition where social interactions, like being with other people, cause irrational anxiety or fear, self-consciousness, or embarrassment.
How is it diagnosed?
Okay. Um, well, we diagnose it through the diagnostic interview. We sit with the child and ask a bunch of questions, and we discover if these symptoms persist of generally excess fear of situations in which they might be judged, or they're worrying about being embarrassed or humiliated, or they're worried about offending someone of how they say or what they say, or worried about making a mistake to look dumb. And this causes them to avoid these social situations. And I'll give you some examples of that pretty soon.
What causes this illness?
Okay, there is actually no specific physical, medical, or chemical cause, but several factors can increase the risk of someone getting this diagnosis. For example, if there's a family history of anxiety, especially social anxiety, there's a higher risk. If they have a brain structure, for example, an overactive fear response of the amygdala, it's a particular brain part in the brain, sometimes it's very, very sensitive. Sometimes if they've had negative experiences in the past that they couldn't really get over, they couldn't get healed from that. For example, being teased, bullied, or ridiculed, that can cause later social anxiety. Sometimes it's temperament, which means they were born that way, like shy and very timid, and causing them more avoidance and causing them to be so self-conscious not to try new things or meet new people. And another one is environment, meaning even learned behavior. Parents sometimes model anxiety, like their behaviors in social situations. So they kind of think, oh, then that's something to be afraid of too. So environmental factors such as that.
How can we recognize when a child needs professional help?
So basically, there's this persistent, ongoing fear and avoiding normal social situations because they're saying it's causing them embarrassment, worry, or panic. Even if they tried it a few times and nothing happened, and they're still trying to avoid. So for example, this can come out as daily school refusal, meaning they're really trying to avoid going to school. But it has nothing to do with they don't want to study, or they don't like the teacher, or they don't like the desk or the campus. They will share because they're so afraid of meeting people or meeting them again and again. Avoiding parties, even fun parties, birthday parties, or play dates, or going to the playground. Most kids would gravitate and want to do that, but they just want to be by themselves. Starting conversations, sometimes it's even with adults, and usually anyone who can come to them at their level. A lot of teachers, especially you guys, are very good at starting conversations with kids and making them feel so wanting to be heard. But somebody with social anxiety would be so scared to answer that. Poor eye contact is another way to know. Meeting friends, even though they've met them before, that could also be a sign of social anxiety. Unable to use a public restroom. I mean, they have to go pee and they can't go to the public restroom. That could be a sign as well. Ordering food at a restaurant. They can't speak for themselves. They're always saying, tell them for me, right? So that can also be social anxiety. And then also eating alone. In the lunch area, they don't want to hang out with the other kids and chit chat and talk, and they'll just eat in a corner. And if you ask them, the symptoms are usually, I'm afraid of looking stupid. I don't want to say the wrong thing. They're going to judge me. They think I look ugly. Those kind of symptoms.
Then is there a big difference between someone who is introverted versus someone who is socially anxious?
Very good question. A lot of people think those two are the same, but it's very different. Introverted, the pure definition of that is they have to have time alone to regain their energy. And if they are around too many people, it saps or takes away their energy too quickly. So they're very tired and drained, and they feel like, I don't want to be around other people. But the person with introvertedness who does not have social anxiety disorder, because I guess you could have it at the same time, but let's say there's someone with introversion tendencies, they will not say, I'm afraid they're judging me. They won't say that. I'm not afraid of meeting new people. I just can't be around them too long or too many for a long time.
Then for a child who is extremely shy, that's a little different too, right? So very shy that they don't want to be on stage and they don't want to go to new places. They don't want to meet new people. Could that be something we should worry about?
That's a really good question because so many are that way. But with proper prompting and prodding and encouragement, they should continue developing and growing up, being willing to try those things and realize, oh, that wasn't so bad. If it's very, very persistent, no matter what developmental age group, then it starts to become a worry.
What are typical treatments for kids who actually get the diagnosis?
When it's a serious social anxiety disorder, I always say number one treatment is the psychotherapy, because the therapist, the psychotherapist, helps the child, and also parents can learn those methods of challenging the irrational thinking, the irrational, incorrect belief that they have about meeting that new person. And challenging them, what's the worst that could happen? Just because you order the wrong dish, you really wanted to say pancakes, but you accidentally said toast, is that the end of the world? And so that kind of challenging the incorrect thinking, what we call cognitive distortions, is actually the number one treatment of choice that we do here in America. Sometimes it's so severe where they're totally going to refuse to go to school. They are fighting you. They're going to physically fight you and not get in the car. Or they're going to physically fight you and not get out of the car. And that was one of my clients, I remember. Those kind of situations, I had to give medications to really calm the storm of excessive fear and paranoia.
What can parents or teachers do to prevent or alleviate symptoms?
Well, to be honest, it never hurts to get help early, because for something like this, the longer you wait, it's harder to treat, because the solidification of the reasons for why they're anxious, they avoid more and more frequently. They avoid more and more situations, and then it becomes truth to them of, I'm going to be judged, or I'm going to make a fool out of myself. No one's going to like me. So it doesn't hurt to get help early. Another way is, as parents or teachers, could be journaling and making observations. The frequency, how often is this happening? The types of situations that are causing it, what kind of patterns are happening that increases the stress level in the social situation, so that you can find out, is it just shyness of performing something on stage, or shyness of meeting someone for the first time but they're okay the second time. So there's a lot of different unique patterns of every child. And then lastly, is to have a balance, right? For example, try not to give too much pressure and push them through that social situation. No, you really have to go to that party. I'm going to drop you off and I'm going to go, okay? Sometimes we can't just totally throw them into the pool. And at the same time, try not to over allow avoidance. Because a lot of parents are so scared for their child. Okay, if you don't want to do it, you don't have to do it. We'll never do it again. Then that's not a good balance, right? And then, of course, don't forget the spiritual aspect, right? Of giving them maybe the purpose of meeting new people. Even as a young child, it's sometimes those with social anxiety, it's not good enough to tell them, it's normal for you to have friends. You have to have friends. You have to have a lot of friends. That's what kids do, right? Which is kind of true, but for a child who has accepted Jesus, they know that they're children of God, you can add an extra message to that. There's a lot of fear, and let's really analyze where that fear is coming from. But who are you? Whose judgment really matters about you? And who knows, this Jesus in you trying to bless your life maybe wants to bless your friend's life just because you are their friend. And when you're with them, then Jesus is with you there. And maybe they'll be blessed because of that. I know that sounds somewhat abstract, and children of different ages might not understand that, but I think you're understanding what I'm saying, right? Where we bring in the purpose of why make friends, why make good friends, and why they can be a good friend.